Hi, I'm Dr. Victor Dolan, and I know that your most precious asset is your good health. I also know the best way to attain and maintain that good health is naturally, through diet, lifestyle, exercise, education, and information, and that's what this show is all about. Good health naturally. Hopefully you'll be able to use some of the information that I give out today. My first shot at doing a soliloquy, my first shot at not interviewing someone, but I wanted to talk about blood testing. Blood testing, quite well accepted, quite scientific. I want to talk about a comprehensive blood test that many healthcare practitioners are doing today. Your medical doctor, your chiropractor, your NP, your PA, perhaps even a nutritionally minded specialist. Blood testing is a safe, effective way to evaluate your good health or lack of it. And one thing that's important to realize is health is not specifically how you feel. We all know the tragic stories, the sad stories. Oh, he never had a problem. He was just seen by the doctor. He's A-OK. He was walking down the street, had a heart attack, and died. Unfortunately, according to statistics, probably 40% of the time, the first pain somebody feels is the last pain they feel with a heart problem that builds up over years or decades. Smoking cigarettes, improper diet, lack of exercise. The vessels can close up over time, and people are unaware of what's going on inside their body, inside their heart. And literally, the first symptom can be sudden death. So blood testing or imaging, CAT scans, MRIs, EKGs, all these testing, particularly when there's a family history, a social history, some sort of risk factor, testing is important if there's any suspicion of any type of subtle, hidden, insidious health problem, organic or otherwise. So one of the easiest ways, one of the most comprehensive ways that we can investigate our health, evaluate our health, is with a simple blood test. Now, that blood test, you go and they stick a needle in your arm and take out some vials of blood. Might be one vial, could be 10 vials, but once you get the needle inserted, that little pinprick, the pain is over with, hopefully for you. The blood is drawn, and within a few days you can have a very comprehensive view of your blood. Now, blood testing can be done to determine disease or lack of it, health or lack of it. Again, many healthcare practitioners now are doing blood testing because it is safe and effective and cost-effective. Many times you can go and get even investigational blood tests done at a relatively inexpensive rate, or many times when you're evaluating health, your insurance company will cover if you're looking to rule out a disease process or to see how healthy you are. But a simple blood test, a simple draw of a few blood vials can tell the shape you're in. Now, one of the ways that many nutritionally minded health practitioners, MDs, DCs, NPs, PAs, many primary care doctors out there nowadays, many chiropractors, for instance, send their people out for blood tests, not only to scout for possible organic problems or disease, but also to look for the status of the health and what vitamins or what therapies may be helpful to return blood values, blood lab values to normal. One thing that's important to realize about blood lab values, blood labs, laboratory values, are determined by norms, and they have a range. Let's say the range is whatever the blood lab is, but the normal is 10 to 50. That 10 to 50 milligrams per deciliter, or whatever the measurement is based on the population, not just of the United States or not just of the whole planet, but also part of the region you're in. And norms can vary country to country, region to region. But if the norms are 10 to 50, meaning that below 10, someone is going to be treated for a disease or decrease in that blood lab value, the symptom of that blood lab value, or if the value found in your blood is above 50, then some sort of medication or vitamin or exercise, some sort of treatment, some type of modality is going to take place. But 10 to 50, that range, that normal range, is called the normal range. And above or below that now is a symptomatic range or a clinically significant range where a symptom or disease may be declared and treatment necessitated. But from a health point of view, often if that range is 10 to 50, an actual optimum or a healthy range might only be 20 to 40. Once you start to get above 40 or once you get below 20, now you're showing a tendency towards developing that disease or that symptom that is going to proceed to progress to the need for some type of medicine, treatment, supplement, modality, whatever it is. So when you take a blood test, make sure you ask your practitioner. Now, is this actually a healthy range, or am I a little high, a little low? Because over time, that little high or little low can be forewarning you as to the development of a problem. And perhaps early intervention, which we are all taught, early intervention is more successful, preventing the symptoms or the full-blown disease or problem from developing. Early intervention, even on the high end of normal or low end of normal, perhaps there are simply some supplements that you can take or some lifestyle changes that you can take that will prevent you from proceeding into that clinical range. Now, talking about how norms change. Norms have changed over time. 30 and 40 years ago, there were different lab values for the same exact laboratory chemical that you're looking at. For instance, 30 years ago, there's a blood test called the BUN, and the BUN has been expanded today. People considered normal today would be under treatment 30 years ago. And now the high end of normal or the low end of normal is left alone, but it is indicating that you are proceeding to a problem. Years ago, ESR, erythrocyte sedimentation rate, a sign of inflammation, was changed. Now, everyone walking around, according to values from 30 years ago, everybody walking around is inflamed. And inflammation is often thought of as the cause of many symptoms or disease processes. Perhaps taking something as simple as omega-3 essential fatty acids in reply to testing would bring down the systemic inflammation and prevent the development or progression of more serious problems. So laboratory value changes, expanded normal ranges, many normal or healthy people today would be considered sick years ago, but we know that early detection can make a difference. And yet nowadays it seems as if detection is actually coming later. I have a short video to watch on how do they calculate blood lab values, why do blood lab values change. So it's almost 2 minutes in length, and I'm going to ask the control room to insert that video right now. How do they calculate blood laboratory values?
Laboratory test ranges have changed over the last 30 years. Your medical doctor probably doesn't know this. For instance, blood urea nitrogen, BUN, is a test that, when elevated, indicates kidney disease or dysfunction. About 30 years ago, the clinical range for BUN was 10 to 20 milligrams per deciliter. Now in 2018, the clinical range is 8 to 27 milligrams per deciliter. These clinical ranges have changed based on population averages. So, 30 years ago, if you had a blood test and the BUN was 26, you would have kidney disease and be treated accordingly. But today, a value of 26 is considered normal. This means kidney disease has to be more advanced today before it can be clinically diagnosed. This is not good. The ESR, a blood test indicating inflammation, used to have a normal value of less than 8 30 years ago, but now the range for ESR is less than 20. This too is based on population averages, indicating that now today, people have much higher levels of inflammation, ESR, that is considered normal until the magic number of 20 is reached. These are just two examples, but just in the last few months, the normal levels for testosterone in men have dropped over 100 points, and the thyroid value T3 total has also significantly dropped, such that now men can have much lower levels of testosterone and people can have lower levels of thyroid function. That is now the new normal. People are sicker than ever, but it is not diagnosed until it's much more advanced. Because a laboratory value is common, it is considered normal and accepted as healthy. Truly, disease is now considered healthy with the new laboratory clinical ranges. Science-based nutrition members are trained to not only identify disease or pathology clinically with laboratory testing, but also to see those areas that are not optimal, that can often be improved easily.
Okay, we're back. I hope you enjoyed that blood lab value video. It's available on YouTube if you want to catch it again, public domain, but it shows the difference from healthy or normal 30 years ago and the difference nowadays, how we've altered the definition of health, symptoms of health and disease, when we should begin treatment, and of course, treatment can vary. Some things necessitate medications. Some things, again, necessitate lifestyle changes, perhaps supplements, perhaps exercise, besides perhaps weight loss. But the earlier we can catch a problem before it's full-blown, by either an individual blood lab value or a pattern of blood lab values, we can take that early detection, do early treatment, and prevent the damage that the full-blown health condition causes. Now, many healthcare practitioners are doing these blood tests in order to determine vitamins, supplements. Many people go to the healthcare store and the drugstore or the vitamin store, and they say, I have an upset stomach. I need a vitamin for my upset stomach. And symptomatic treatment can be helpful, but the symptom may be distant from the actual problem. And a blood test can decide, do you need betaine hydrochloric acid? Do you need enzymes? Do you need something else in your supplement package to take care of that upset stomach? Maybe you have an ulcer. Heaven forbid, maybe you have a tumor or a cancer. A simple blood test could tell you if it's something remediable by supplements or exercise or stopping smoking or some side effect from a medication that you're going to have to put up with. But a simple blood test can tell you if a supplement may help, if a medicine is necessary, what is the cause of that upset stomach. Upset stomach to a doctor of any sort doesn't mean much. You have to get to the cause of that stomach upset. That's talking about the value of blood tests and the changes in blood laboratory values. And some people say, well, I'm not going to worry about doing a blood test to determine my vitamin needs. But on another short video, I'd like to call up Why Take Vitamins. Why take vitamins? Because our food today is not the same. Grandma and grandpa, even our parents, even my generation, I've been in practice almost 40 years now. We had unadulterated, unpolluted food. There were less preservatives, there was less frozen foods, there were less canned foods, there was less fast foods, and we've adulterated our foodstuffs. And even this century, 15 years ago, so the Journal of the American Medical Association finally came to the conclusion that people should take a multiple vitamin every day. Everyone should take a multiple vitamin. Now, if you're taking a multiple vitamin, how do you know you're taking the right one for you? Oh, we're back to that blood test again. Perhaps you should do a comprehensive blood screening to know what vitamins are working for you and what vitamins are not working for you. But, this video will show you why take vitamins. This one's long, about 2.5 minutes, 2 and 5 seconds. Why take vitamins? You should be taking vitamins for your targeted problems, for what shows up on your blood test, what you need. And, well, let's go to the video, why take vitamins.
Why do I need supplements if I eat right? You can eat 5 servings of fruits and vegetables and still not get enough vitamins and nutrients for good health due to the quality of foods and the ways they are produced. Our food today is grown on land that has been farmed for well over 50 years. The quality and mineral density of the soil is greatly diminished due to over-farming and the chemicals, pesticides, and herbicides that are commonly used. One study found 43 different vegetables and fruits had significant declines in the amount of protein, calcium, phosphorus, iron, riboflavin, vitamin B2, and vitamin C from 1950 to 1999. The Organic Consumers Association notes similar findings with several other studies. The Cushy Institute analysis of nutrient data in the United States from 1975 to 1997 found that several nutrients dropped dramatically in the 12 fresh vegetables studied. A similar study published in the British Food Journal found that 20 vegetables had similar declining rates of nutrient value from 1930 to 1980. Yet another study concluded that one would have to eat 8 oranges today to derive the same amount of vitamin A as our grandparents would have gotten from just one. It appears obvious that vitamin supplements are necessary. In 2002, the Journal of the American Medical Association, reversing a long-standing anti-vitamin policy, started advising all adults to take at least 1 multivitamin each day. That was a small step in the right direction, as studies since then indicate that the higher quality foods our grandparents ate might be a major reason why that generation has less cancer, diabetes, and autoimmune disease than people born in the U.S. in the last 30 years. It is estimated that over 60 billion doses of supplements are taken every year in the United States, and the last study in 2010 did not find a single death due to vitamin supplements. The lack of proper supplementation is far greater than the risk of oversupplementation. Several studies indicate the benefit of certain supplements, such as reduced birth defects with folic acid, and reduced breast cancer and MS with vitamin D. There are literally hundreds of other studies on the benefits of other vitamin and nutrient supplements that are easily found with a simple Google search. There is no doubt that there are many other factors that can lead to higher levels of cancer, diabetes, heart disease, degenerative conditions, and autoimmune disease. But making sure that nutrient intake is optimal will always be beneficial. How do you know if you are deficient or taking the right vitamins? Without testing, you are guessing about your health. A thorough blood test and evaluation can identify deficiencies, imbalances, and diseases long before you have symptoms. Talk to us about getting tested properly and thoroughly. It is cheaper than you think, and it just might save your life and help you live longer and healthier. Start by completing our patient symptoms survey, which aids in determining what comprehensive tests to order, informs us of any medications you are taking, and indicates the symptoms you are experiencing. Once your test results are in, we compile all of the data in a comprehensive, color-coded report that is easy to read and understand. Using your unique test data, the science-based nutrition report will reveal your underlying health deficiencies and indicate the nutrients and diet that will likely help you progress toward a healthier you.
Well, I hope that was informative for you too. Again, that's available on YouTube, public domain, well worth watching. And why you need a blood test to determine what vitamins you should take that are targeted for your problem, besides everyone needing a multiple vitamin, which is just a basic supplement nowadays. People should take vitamins targeted for their problems, their specific problems. You may be taking vitamins based on symptoms. You may be taking vitamins because you belong to a specific vitamin line or vitamin group. Wouldn't it be nice to know that these vitamins that you are spending money and time on are fit for you? And back to that upset stomach. Your upset stomach may be caused by one problem that can be addressed by certain supplements. Someone else's upset stomach may need different supplements, may need surgery, may need a medication. And a blood test, going for that blood test, can tell the difference and tell your practitioner by the individual blood lab values and by the patterns of those blood lab values, what supplements, what you should do with your health or lack of it. Now, one thing that's close to everybody's concern nowadays is cholesterol. 80% of our cholesterol is made in our liver. Only 20% comes from dietary sources outside our body. And cholesterol is the foundation, the stuff that our hormones are made of. Even cholesterol goes up when we have an infection. Cholesterol helps fight infection. But I have a short video on cholesterol, some information on cholesterol that's a very common complaint nowadays. So we'll go to that minute 20 seconds cholesterol video. We'll call that up. I roll into the control room. Here's a short video on cholesterol from YouTube.
Cholesterol is a major building block for a healthy body. While optimal levels are best, it is vital to determine the cause of your high cholesterol before simply taking a statin. Low cholesterol may be more dangerous as it puts you at greater risk for infections, malnutrition, autoimmune disorders, cancer, and reduces your ability to absorb fat-soluble vitamins like vitamin D and K. About 80% of total cholesterol is made by the liver, while the remaining 20% comes from dietary sources. Cholesterol travels from the liver through the bloodstream by protein molecules called lipoproteins. From there, the body's cells can extract what they need, leaving the remaining cholesterol for transport back to the liver. While often receiving a bad rap, cholesterol is actually a major building block for hormones which regulate blood sugars, blood pressure, stress, sex hormones, and digestion. Diet and exercise are only part of the story. Your body will raise its cholesterol levels to protect itself against toxins, bacteria, infections, and other threats. Stress, poor nutrition, thyroid, and liver problems also cause high cholesterol. If you take a statin to lower cholesterol levels, are you healthier? Have you fixed the problem? Start by completing our patient symptom survey, which aids in determining what comprehensive tests to order, informs us of any medications you are taking, and indicates the symptoms you are experiencing. Once your test results are in, we compile all of the data in a comprehensive, color-coded report that is easy to read and understand. Using your unique test data, the science-based nutrition report will reveal your underlying health deficiencies and indicate the nutrients and diet that will likely help you progress toward a healthier you.
I hope that answered some of your questions. As you know, there's good forms and bad forms of cholesterol. There are ratios involved. Again, with a blood test, you can tell if that ratio shows that you're actually healthy or that you're not healthy. If you have the unhealthy cholesterol, you better do something about it. And if you have that unhealthy cholesterol, it might be simply to lose 20 pounds, 30 pounds. It may be simply to do 40 minutes of exercise 4 days a week, and it'll bring up your HDL, which is the good cholesterol, and lower the LDL, which is the bad cholesterol. And you may be able to alter your cholesterol readings by diet and exercise, or you may need medication for it, but you don't know about your cholesterol until you take that blood test. So one of the points of my diatribe today on the show is you should go out and get a comprehensive blood screening test. From that blood screening test, there may be other blood tests that are needed, or other tests in general, an EKG, an EMG, a urinalysis, whatever other testing may be kicked off by that first scout of a test. But blood testing is the way your healthcare practitioner can evaluate your health or lack of it with or without symptoms. Health is not how you feel. Health is how you are, and perhaps you have to dig deeper than saying, I feel good or I feel bad or anything in between. Now, a comprehensive blood test that I'm talking about nowadays is more than just blood sugar and cholesterol. It can be 50 or 60 different blood lab values. There are a lot of labs out there that are not commonplace, but are easily ordered by your practitioner, be it MD, DC, NP, whoever your healthcare provider is, PA, who is nutritionally minded, or who wants to rule in or rule out different symptoms or different disease processes and the need for medical intervention or other lifestyle changes. The blood test commonly used in many chiropractic offices, many medical doctors' offices include about 60 or 70 different values. Cardiac panels, something called the Cleveland Cardiac Panel, which includes different hormones and blood chemistry components that show how good a shape your heart is in addition to perhaps that EKG or ultrasound or whatever else other imaging they may do to take a look at your heart and lungs. But different blood tests can take a look at the chemistries available to your heart, your lung, your liver, and not only tell of a disease process that's ongoing, but the pre-disease states that may be modifiable before you proceed to true damage, to true problems with your health, perhaps the loss of some weight or taking Silymarin for the liver. Perhaps these things would be helpful to you before the need of medications or surgery. And go out and get that blood test. Go out and get targeted nutrition, targeted exercise, targeted lifestyle changes to target your health and illness, and target that illness and get rid of that illness. As we close, one of the things that are done in a lot of offices is I'll show you a blood lab, and hopefully we can insert this before we leave, but this has 55 different blood values: red, blue, white, yellow, and it indicates patterns of problems that could necessitate treatment. We're counting down. I'd like to thank everyone on Staten Island. Thanks for watching, and I wish you all good health naturally.